I would say, in no particular order, but clinical research accessibility, access. It's really hard as a community practice to attract great clinical trials. You can, if you maybe have a local affiliation with a hospital, but if you're just a small independent practice, access to clinical research can be tough. Second, you have to be very efficient as a practice these days. There's a lot of shrinking margins, payer pressure, value-based care, hospital pressure that make it hard to be a practice. So there's a lot of pressures there. So we, through software and services, help those practices remain independent, even in a low margin environment. And then also I'd say access to information. So OncoEMR has a lot of content built in. It helps you diagnose patients easier, helps you make treatment decisions more effectively with integrated content from nonprofit institutions. And so it basically provides medical oncologists with at their fingertips information because they're seeing maybe 20 different types of cancer in one day in their patient population. Oh, for sure, yeah. I think the biggest areas would be, well, certainly clinical trials. We're just starting there. We have a relatively nascent product, OncoTrials, that has a long way to go that we're really excited about. And we also need to bring our own clinical trials through sponsors to the table. Revenue cycle management practices need to, in this low margin world, be much better at collecting insurance for their patients, for their services provided. And our revenue cycle offering is just coming off the shelf. We have only 3 or 4 clients. So we're really excited to see that develop over time. Practice management software, both developed by Flatiron but also interfacing with third parties. That's becoming very critical. So that's what I would say.